Good evening. My name is Michael Colbert, and this is our presentation for child and adolescent physical neglect. Okay, first we start with symptomology and overlooked symptoms of physical neglect, as well as its prevalence in Texas. So these first few slides will be covering that, okay? So physical neglect is the failure to provide basic life necessities like food, clothing, and shelter, and medical care. In Texas, neglect is the most common form of child maltreatment, accounting for the vast majority of confirmed child abuse cases. Statewide, substantiated child abuse and neglect rates have trended downwards in recent years. While overt signs like malnourishment or severe hygienic issues are easily recognized, physical neglect often hides behind subtle symptoms that are missed by the casual observer. Some behavioral indicators of physical neglect are hoarding or stealing food. A neglected child may compulsively hoard snacks, steal food, or intensely beg for sustenance. Over-the-top compliance, trying excessively hard not to do something wrong or to avoid drawing the attention of an unreliable caregiver. And fatigue, frequently falling asleep in class or displaying profound lethargy due to an inability to sleep at home, usually coming from poor living environments. Next, we've got our developmental and medical indicators of physical neglect, okay? And they can include things like stunted growth, so not meeting expected height and weight benchmarks for your age group, frequent minor illnesses, like a reoccurring cascade of untreated ailments such as chronic ear infections, untreated cavities, or lingering stomach aches, as well as developmental delays, which would be delayed gross motor skills such as sitting up and walking, or cognitive and or language delays. Environmental indicators can include inappropriate clothing, as in wearing something that's not suited for the weather, such as wearing a sweatshirt in the middle of the summer. Wearing clothes not suited for the weather, such as heavy coats in the summer, light rags in the winter, or consistently wearing the exact same dirty clothing. Okay? Additionally, you have unsafe living condition. The child's home may suffer from faulty plumbing, lack of heating and cooling, visible mold, even fecal contamination or pest infestations. Okay? Okay, so its prevalence in Texas. Child neglect remains a widespread issue in Texas, according to historical data trends. Neglect has historically made up over 80% of confirmed maltreatment cases in the state, because state agencies like the Texas Department of Family and Protective Services have shifted to classifying severe versus mild cases of neglect. Raw data reporting metrics have varied. However, the broader picture of child maltreatment in Texas indicates the victimization rate. Substantiated child maltreatment victims occur at an estimated rate of about 7 children per 1,000, showing a steady improvement over time. Age breakdown: infants under 1 year old are consistently the largest demographic of victims, representing roughly 18% of all reported cases. And the demographic statistics indicate that Hispanic and African American children have traditionally represented a disproportionate share of child maltreatment victims in the state compared to their percentage of the general population. Okay, so next we're going to talk about ethical assessments and screening. Ethically screening children for physical abuse requires a trauma-informed, developmentally appropriate, and multidisciplinary approach. The core priority is protecting the child while ensuring the assessment process, whether medical, educational, or psychosocial, does not cause secondary trauma or violate the child's dignity or introduce systemic bias. Medical professionals evaluate physical abuse through a combination of history, physical examination, and diagnostic imaging. Ethically, these assessments must be conducted with transparent communication with the non-offending caregiver. Trauma-informed interviewing involves asking open-ended, non-leading questions to the child and caregivers, and the explanation of injuries must be evaluated for consistency with the child's developmental age and motor capabilities. Physical assessment screening tools such as the 10 faces P rule, 10-4 faces P rule, are widely used to identify high-risk, abusive bruising on specific areas of the body in young children. A complete skeletal survey for all suspected victims under the age of 2 and cranial abdominal imaging to assess for internal trauma is recommended by the American Academy of Pediatrics. Outside of the clinical setting, educators, counselors, and social workers often serve as the first line of observation. Screeners look for sudden behavioral shifts such as extreme withdrawal, aggression, regression in developmental milestones, or fear of specific adults. Validated standardized tools such as the Childhood Trauma Questionnaire are often used to screen older children or adults about historical or ongoing trauma. Educational and community screeners must focus on objective observations of the child's environment, avoiding attempts to interrogate or definitively diagnose the trauma. Ethical screening hinges on minimizing harm, avoiding biases, and respecting the child's right to safety. Screeners must not let assumptions about a family's socioeconomic status or background dictate their reporting. Clinical assessments must always rule out underlying medical or bleeding disorders that mimic abuse. Interviews should be conducted in safe, private spaces by specially trained forensic interviewers to prevent the need for the child to recount their trauma multiple times. School personnel and medical professionals are legally and ethically obligated to report reasonable suspicions to Child Protective Services, with the ethical goal of triggering protective interventions and supportive services for the family. Okay, next we're going to talk about reporting abuse in Texas, since we're in Texas. In Texas, any person suspecting neglect or exploitation must legally report it. If a child is in immediate danger, you call 911. Otherwise, mandatory reporters must contact state authorities within 24 hours via the Texas Abuse Hotline, which is 800-252-5400, or report securely online. Texas law imposes a strict legal obligation on all adults to report suspected abuse with an accelerated time frame for professionals who must report to authorities within 24 hours of first suspecting the abuse. In school districts, reporting cannot be delegated to the principal or administration. The individual suspecting the abuse must make the state report themselves. State law requires school districts to notify a parent or guardian within one school business day after an employee first suspects that a criminal offense has been committed against their student. Principals must report allegations of employee misconduct to the superintendent within 48 hours. The superintendent must then escalate these allegations involving educators or staff to the Texas Education Agency and the State Board for Educator Certification within 48 hours. If a school or district fails to follow abuse reporting laws, you can file a formal complaint using the TEA General Education Complaint Form or follow your district's internal grievance policy. All right, last one we're going to talk about is vicarious trauma. That means secondhand trauma. Okay, so as school counselors, we hear a lot of stuff during the day. We hear a lot of negative things, we hear a lot of bad things, and it can weigh pretty heavily on a counselor. So we're going to talk about how to deal with that. Okay? School counselors, we can address vicarious or secondhand trauma by establishing strict personal and professional boundaries. Okay, seeking regular clinical supervision and practicing consistent self-care. Because school counselors often absorb students' trauma, implementing preventative wellness frameworks and active coping strategies is crucial to sustaining a healthy long-term counseling career. We do this by, number one, leaving work at work. You could have like an internal off switch. So once you walk through the doors of the school, that's done, okay? Work stays at work and does not come home. You set clear hours for when you check work emails and stick to them. You can also use your commute as to decompress or practice a physical transition, such as changing your clothes as soon as you get home, which symbolizes the end of your workday. That's one I use a lot. Next, you can connect with a district level counseling supervisor, mental health specialist, or mentor for regular case consultations. You'll use this time to process how specific student cases are affecting your own worldview. And finally, dedicate time to the basics of health. Get enough sleep, balanced nutrition, regular movement. Incorporate evidence-based practices like mindful meditation or journaling to actively process your emotions and release built-up stress. Thank you very much. Very much appreciate your time. You have a great evening.